Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, I'm talking to international board-certified lactation consultant, Alan Gulson. Alan is the operations manager for the Australian Breastfeeding Association in ACT and New South Wales, and works in private practice as a lactation consultant. She's also worked in the neonatal intensive care unit at the Royal Women's Hospital in Sydney. And of course, I can't forget Alan is the proud mum of 4, which totally makes my head spin thinking about, but that's another story. And today we're going to be talking how breastfeeding is a learnt skill for both mum and baby, which genuinely takes time to learn. We'll talk the reasons why it's so important to get good advice and support early on, your caloric requirements for breastfeeding, and what to expect when you have your first baby. Alan, thank you so much for taking the time to talk to me today. It's fantastic to have you on here.
It's okay. I'm happy to be here. Happy to get good information out there into the world.
I think the best place to start is actually talking about how you got into this line of work and the process of becoming a board certified lactation consultant, and what the difference is between someone that is international board certified and someone who isn't board certified or is just like your general lactation consultant. So do you mind if we start talking about that?
Perfect, because I didn't have a very straightforward journey to this space. I don't think anyone grows up when they're a kid and goes, I know what I want to be when I'm a grown up. I want to be a lactation consultant. So it is
I don't know, maybe some guys would.
maybe. Although I've yet to meet a male lactation consultant. I'm sure they exist out there in the world. I just haven't met any. So I actually started out working in corporate. I worked for national governments and for big corporates in Sydney. And then I had started my family in my late 20s, having my first baby, I think minutes before I turned 29. And I think, like a lot of women, having my first child completely changed my perspective on what I wanted from my life, what I wanted my life to look like, and what I wanted to get out of what I did for a living. I felt a need to be working with people in a care-based profession. But I didn't know what that looked like. And then my first child was an absolute disaster when it came to breastfeeding. He had every possible problem. He was hospitalized a few times, and I got some really good help and I got some really crappy help along the way. And I think that started guiding me towards the postpartum care space. So I started volunteering with the Australian Breastfeeding Association as a breastfeeding counsellor, and rolled on to having another baby and then another baby and then another baby. I had 4 in 4.5 years. And during that period of time, whilst I was having those babies, I went back to uni to do nursing. I did extra qualifications in breastfeeding, offered usually just to nurses, midwives, GPs, and physiotherapists. It's a specialized course. And then I did about 1,000 hours of supervised and supported breastfeeding care, mostly during the pandemic. I was working in far north Queensland with a GP up there, providing care to a largely young mum population, Indigenous mums. And it just was everything I wanted from a profession. It focused on people. It gave back what I felt I'd gotten in help with my own child, as well as I felt making a difference in people's lives day in, day out. And when we moved back to Sydney mid-2021, I sat my board qualifications. So that's an international exam run out of the US. It's the only recognized qualification in lactation internationally.
Right.
You can't go to university and get a degree in lactation. This is the only place to get it. And you can only sit the exam if you have university level healthcare training. So nursing, midwifery, GP, and physio are the usual ones. Speech therapists sometimes also do it. Then you have to do that 1,000 hours. Now, most of us end up doing 1,500 or 2,000 before we actually get around to sitting our exam, and they have to be signed off hours. And then you have to go through additional training in breastfeeding, and then sit a very grueling 5-hour exam, which is only offered every 6 months or so. I think about 70% of people fail that exam. It's pretty full on. And luckily I passed. I did pretty well, I think. And now I'm working in private practice in Coogee. I see my own patients there as a part of a multidisciplinary team of GPs, shared care GPs with the Women's Hospital, as well as doing occasional shifts in NICU, although I'm doing less now that I'm seeing more private patients, and working for the Australian Breastfeeding Association, training more counsellors to come up behind me, because we do not have enough of us in the world. The more people we can have trained, the better.
So that's quite an intensive training schedule that you've just been through, and how long did that take you to get that qualification from start to finish, like all up? Because I think it's good to differentiate between, that kind of education and someone that I will talk about the other courses that you can do, because I think it's important to get that delineation.
Absolutely. It probably took me about 5 years beginning to end. I started the process when my eldest was born. He just turned 9. And I've been qualified since 2021. So about 5 years, although I did have occasional breaks in there to go and give birth. So it is intensive. And I am a specialist in lactation and not all parts of nursing. Like, it is a very specific skill set and in baby feeding generally. And the reason we have to have that level of qualification is because we are dealing with a very vulnerable group of people, both postpartum mums, who are an extremely vulnerable group themselves, but also newborns who can't advocate for themselves. And these are a group that need to be nourished to live. And my role, I see, is making sure those babies are getting the optimal nutrition. And sometimes that's breastfeeding, and sometimes that's mixed feeding, and sometimes that's formula feeding. But I see when I get a mum and her baby come in, I have 2 patients in the room. I have the mum and I have the baby, and I have to look at what's best for both of those people equally. And get the best outcome for both of the people in the room. And sometimes there's 3 or 4, depending on if we've got twins or triplets in the room. But
true.
Yeah. So if you go and see an early childhood nurse, for example, at your early childhood centre, her patient is the baby. And you'll get wonderful early childhood nurses that care deeply about their mums as well. But their primary patient in the room is the baby, not the mum. And the midwives looking after you during your pregnancy, their goals are to get you delivered of a healthy baby. So all of these different professions that contribute to postpartum care in the healthcare space have different roles and different patients and different goals to get you to. And my goal in looking after you, and any lactation consultant's goal, is to make sure mum and baby get the best feeding journey that they can.
Right. Okay. Excellent. And I'm not very across this area, so this is all very interesting to me as well. Can you just go to I don't know, can anyone just be like, I'm a lactation consultant?
Oh, look, there is any number of people will call themselves any number of things online.
Yeah. Okay.
And what you're looking for is the IBCLC code, so International Board Certified Lactation Consultant. So there's an international board certifying us. We have to have all of that training I talked about, sit the exam, and then we need insurances and regular professional development. And we have a board overseeing us, just like the Nursing and Midwifery Board of Australia, who oversees nurses and midwives. We're governed by that board. So there is a website you can go to, which I can give Tammy the link to, and we can include it in the notes, for LCAN, so Lactation Consultants of Australia and New Zealand, where you can go and you find out where a board certified lactation consultant is close to you.
Yeah.
And also check someone's credentials. So if someone's claiming that they are that, you can go and check that qualification against that website.
So it sounds like, to me, if you're looking for someone to help you with your breastfeeding journey, whether it's during pregnancy or whether it's in the postpartum time, you really want to make sure that they are board certified. So have that IBCLC.
Yeah. Look, there you might chance it and get a fabulous midwife who also happens to be great in the lactation space. But the reality of nursing and midwifery degrees in Australia is they don't focus hugely on breastfeeding. There is a very small amount of that. They've got so much to learn that they'll only be competent in that space if they've gone out and individually sought extra training. So if you want the best for yourself and your baby, so looking for someone with that qualification is the most important thing.
Amazing. Now, I know that you wanted to talk about breastfeeding being a learnt skill.
Yeah.
So now that we have got a really good understanding of the process that you've gone through, which is fantastic. Let's talk about why you believe it's a learnt skill for both mum and baby. And, let's talk about kind of how long you think it might take. Because I think, I'm pretty sure that women probably just assume that they're going to be able to.
Yeah, and some will.
Yeah.
Some will. So I like to explain to my patients that breastfeeding is like riding a bike, right? We need to learn how to ride a bike. But the problem, at least when you learn to ride a bike, you've seen people riding bikes. You might have seen it on movies and videos. You will have seen people out in the street. You can sort of work out that pedals turn with feet pushing, right? We're asking women to learn to breastfeed in a situation they've never seen anyone breastfeed. We culturally are conditioned, particularly when we're in our 20s and whatever, when we're young, to look away when someone's breastfeeding. We don't intensely look at someone's nipple when they're breastfeeding, right? So you're not only learning to ride a bike, you're learning to ride a bike having never even seen a bike, right? So babies are born, and yes, it is a natural process, and babies are born wanting to suck. They have a suck reflex that kicks in at about 18 weeks in utero, right? So babies, you'll see them on their ultrasound, they're sucking their thumb, they're making swallowing movement. But just because they're born knowing how to suck doesn't mean they're born knowing how to latch onto a nipple, suck effectively, to remove milk, to nourish themselves. They have an instinct, but not a knowledge base. And then mum is often brought up in a situation, and we're brought up in a culture where breasts are a sexualized thing rather than a breastfeeding nutrition thing. So we are conditioned to look away when people breastfeed and not take a huge interest. So it is natural, but it is learned. Baby has to learn and mum has to learn. And some of that learning can happen before your baby comes. So some of that learning can happen while you're pregnant. And a good antenatal breastfeeding class will teach you the mechanics of breastfeeding. So we'll teach you how your body works. So I think just like with birth and with training, I mean, this is what you do with your patients, Tammy, with your clients, you encourage them to understand the mechanics of their body to see how they can get the best out of it. You explain, this muscle group, your TA, for example, you need to activate it, and you empower women to understand their bodies. And I think any good breastfeeding class will encourage women and empower them to understand how their body works to produce milk and then how to nourish their baby when it comes. That class might teach you, and I certainly teach my patients when they come in, to hand express. So your midwife might talk to you about hand expression in the later stages of your pregnancy, sort of 35 weeks onwards, which is all about learning to handle your breasts, learning how to handle your nipples, Remembering we call it breastfeeding, not nipple feeding, for a reason. Like, your whole breast is involved in the process of feeding your baby. So learning to handle your breasts by hand expressing during pregnancy can help those skills. And then getting some intensive support immediately after your baby gets here to put into place the skills you've learned during that latter part of your pregnancy.
I didn't even realize that there were antenatal breastfeeding classes.
Yeah.
Is that included in the typical education, or is that something that you would, you're like, no, I mean, because it sounds like it would be quite important. So it's not included in the typical kind of education.
Look, it is look, antenatal education as a whole has been deeply affected by COVID. So we've had a lot of antenatal education move online, and I would argue it's very hard to learn breastfeeding in a hands-off, screen-based way. Kind of need to get your hands in there, hold a baby, put a baby to your breast. And we're slowly transitioning back to face-to-face antenatal education, but the breastfeeding component is patchy. And look, if I'm honest, the reason that is patchy is because the most women only want to focus on birth when they go to these classes. They even call them birthing classes, even though they're called education classes or antenatal education classes. They think of them, and when they're talking to their friends, they call it a birthing class. And it's because they're so blinkered approach thinking about birth. And so the bits of information they retain from that course is largely around pain relief options, active labor, breathing techniques, etc. for labor. And there are some breastfeeding courses you can go out and specifically seek out. So the Australian Breastfeeding Association, for example, runs both face-to-face and online courses. Or you can go to an IBCLC like myself and have one-on-one where they can actually do a breast exam, teach you hands-on how to do antenatal expression and that sort of thing. So there are levels that you can get. But my advice to anyone is at least get some level of support and education in this space, because birthing, that day that you birth your baby is one day, right? And it could vary anywhere from a couple of hours to 24 hours, maybe 48 in the absolute worst case scenario. Birth, right?
Worst case scenario.
That baby is going to come out, right? The baby is not staying in there. The baby is coming out, and it will come out one way or the other. And not to devalue the experience of birth, because your birth experience is an extremely important start to your mothering journey. But breastfeeding is going to take an hour at a time, 8 to 12 times a day for the first 6 to 8 weeks. So that's 8 to 10 hours a day of breastfeeding for 6 to 8 weeks. And then it moves to maybe 6 to 7 times a day at 20 minutes a session. So we're talking about hundreds, if not thousands of hours of your time that is going to spend feeding this baby. No matter how you do it, breast, expressing, bottle feeding, feeding a baby takes time and is a huge component of early motherhood. And if we put as much time into teaching ourselves about breastfeeding as we do birth, I think people would have a much smoother transition into early motherhood than a lot of the experiences I witness in practice.
Yeah, I mean, even from a physical standpoint, I've trained hundreds of women.
Yeah.
And I really do believe that the physical impact of breastfeeding on the upper body, on the body in general, is major. Like their birth recovery is relatively quickly. A lot, there are a lot of them. Granted, there are a few that don't recover that quickly from birth, but it's the after effects of all the things that you're doing after having their baby, when they're already in that weakened kind of state, that's where a lot of the problems start to stem from, the upper back pain, the lower back pain, the shoulders, the rotation through the thoracic and all that type of thing. So it makes sense,
And the level of cortisol that will be pumping through your body from a painful breastfeeding experience. Like, we talk about that then the hormonal effects of a poorly attached baby, like you're flooding your body with stress hormone of constant pain over and over when it's not done well. But on the flip side, it can also be, when it goes well, it can be an extremely healing thing. Particularly in the event of a traumatic birth that perhaps doesn't go like you want. A good breastfeeding journey can restore a woman's faith in her own body, in her own body's ability to nurture her baby. It can set her up for a start into motherhood that reflects what she always wanted. And so whilst I do see it as potentially negative, I also try to focus more when I see my patients on the potential positives that it can bring to that diet, to both the mother and the baby.
That's such a beautiful way of looking at that. Like, I feel quite touched by that. Yeah, that's a really nice way of looking at it, because it would make a big difference. And I know I've worked with women who've had not great breastfeeding experiences for all different types of reasons, and how much that has impacted their motherhood journey. So I definitely think that the role that you play in that transition, the transformation into motherhood, the maternal metamorphosis,
Yeah.
I think every woman should have access to this. And the fact
I totally agree. I think that when I hear of stories of where it's gone badly for somebody, I don't think that mother has done anything wrong. I don't think that mother has failed. I feel like the system has failed that mother, that the healthcare profession has not given that mother everything that she needs to have a successful journey. And successful journeys look very different for different people. So a successful breastfeeding journey might only be breastfeeding for 2 days postpartum. So maybe you have a medication that you need to go back on that you can't take in breastfeeding, but you want to give your baby just that colostrum to get the first few days to set up the microbiome, to their gut health, their immune system. And maybe it's only 6 weeks until their first round of vaccinations, and you want to be breastfeeding just for that 6 weeks to give them their first round of immunization before they can get their shot. Or maybe it's 6 months until you go back to work. None of those people stopping at that point is a failure. Whatever happens in that time, and that experience of that mum dictates whether it was positive or negative. What I do is as much about helping a woman to direct breastfeed might be helping a woman to wean, might be helping a woman who doesn't want to breastfeed, because for any number of reasons, like there are a huge number of reasons why someone might not want to breastfeed.
So you've actually kind of segued into one of the questions that I had for you. Yeah, so that's a good segue. I'm just going to jump in here and ask it, because I guess, there are probably women out there that maybe can't breastfeed. They're choosing not to for a variety of reasons. So how can you actually help women who do choose, or there's a medical reason, or they're choosing not to breastfeed, or they find that they can't? Like, how can you help them?
Well, first, I always want to understand from my patient why they're not, because it opens up our opportunity. So if the reason they choosing not to breastfeed is because of previous breast surgery, or a physiological problem, so something going on with their breasts, but they still really wanted the experience of breastfeeding, we can run a supply line. So we basically put a bottle in the top of their bra and run a tube down to their nipple, and baby is bottle feeding, but they're doing it at the breast. And so mum gets this beautiful experience of feeding her baby at her chest. Or it might be that there's a medication that mum needs to take, and we need to get in there and cut off that lactation straight away, in which case there are medications that we can put in place straight away after mum's gives birth. It might be that they've had a previous experience where they haven't produced enough milk, and so they're preparing themselves for the fact that they don't want to feed because they don't want to not have enough again. In which case we could mixed feed if that's something they're open to. But so there are medications, and then there are strategies where your milk's already come in and we need to get rid of it. So once your milk's in, which means that on day 3 or day 4 postpartum, your milk, the milk sacs in your breast fill up. So up till then, there's sort of this sticky liquid in there called colostrum. When they fill up, and it's called our milk coming in, those medications to suppress lactation are less effective, and we need to use the medication in conjunction with things like icing our breasts, lack of stimulation, a firm-fitting sports bra, things like that. But in that instance, you would always want to have some really good medical support. Your midwife can often arrange that in consultation with the lactation consultant at the hospital. Or if it's happening 3 or 4 weeks postpartum, you go and see your GP and get a referral to an IBCLC, and they work together to do the medication and the suppression together. But a good IBCLC will never, ever give you any kind of judgment. If it's a decision that you've made for your body and your baby, I'm here for you. You know, that is, you never have to justify yourself to me. I try and get information just so I can give you the best, quickest path to get to what you want to get to, but never any judgment. There are many ways to feed a baby.
Yeah. So what, like, again, I feel like this is going in exactly the way that this conversation's going in like the right way, because like, you know, one of the other things that I would like to find out about is, you know, I believe that there is quite a bit of a misconception around breastfeeding, and probably maybe around what you do, because I know that a lot of people feel like there's a lot of pressure to breastfeed. So what would you say is one of the most common misconceptions about what you do?
It's tricky because I think that your experience is often coloured by someone you might have seen in the past, or the experiences of other mothers that you know. Often the judgment that we're talking about comes from this concept of breast versus bottle, right? So this, you know, breast is best versus fed is best. And I would say that the biggest misconception is that you have to be in one camp or the other, that there is so much grey area, right? There is so much grey area in the middle of breast only and bottle only, that there are ways to meet everybody's objectives somewhere in the middle of that. And I have no problems with a mum who wants to do a combination of bottle and breast. I would only say that I would give a mum the information that she needs to make decisions about her body. I don't think you can make a decision about what's best for yourself and your baby unless you have all the information available. And so some of that is about understanding how breasts work. So breasts, once milk comes in, have to be emptied every 3 to 4 hours, or you might get an infection. So you can't take the night off, for example. You can't, as much as we might like to, and I would love to tell my mums of new babies, you can sleep tonight and have the night off and get up tomorrow and start again. It doesn't work like that, because if I let my mum do that and encourage her to make that choice, chances are she's going to wake up the next morning with a raging infection in her breast, right? So what I try to do is give mums, meet them halfway. So they say, I'm exhausted, Ellen, I just need a night of sleep. Great. We will set up, I'll get her a double pump. I will set it up beside her bed. I will teach her husband, sometimes partner, how to help her get that breast pump set up and bottle feed that baby, so that she only has to get up for 10 minutes every 4 hours, pump, and go straight back to sleep, right? Or it might be that mum really just wants to feed once a day. She's going back to work at 6 weeks. And I do have mums who go back to work really early and they want to pump at work. Great. We organise that pump. We get it sorted. I help advocate with them, with their employer. So basically, I think I am the mum's partner in trying to get her to whatever her goal is. And so if her goal is more sleep, we'll get her to that goal, but it might not always be the path that she envisaged getting there on, right? So Does that answer your question? I don't know.
It really does. And it actually answers my another question that I had for you as well, which was kind of like, how do you see what you do helping women the most? And I kind of feel like you've just beautifully answered that, in that you help women make sure that their transition to whatever they require, whether it's where they require more sleep or they need to return to work, or, you know, they don't want to be, or they're struggling with the feeding, that's how you help them the most, is that you actually make sure that they're on the correct path in this area, and that they're well supported and well educated, and that they feel well cared for.
I should be someone, they should walk into my room feeling one way and walk out feeling better than when they came in.
Kind of like exercise.
Yeah, exactly. It should feel a weight off their shoulders. And if that is me helping physically get that baby latched so that baby is causing less pain, then that is one way to do that. And that's not the only thing that I do. I help them meet their goals in a way that makes sure both mum and baby are looked after.
Amazing. And so let's talk about a little bit about calorie requirements for breastfeeding, because I know that's quite a big one, and especially in the health and well-being industry, you know. And also, if you could give any information about training during breastfeeding, because from my knowledge and my limited knowledge, the lactic acid buildup and, well, you know, that whole process of building up actually can alter the breast milk. And if we can talk a little bit around like calorie requirements for breastfeeding, and also maybe just things that you need to be mindful of when it comes to exercise, because I know that early when you are breastfeeding or throughout your breastfeeding journey, your exercise routines can actually impact how you feed. And if there's any tips that you have around breastfeeding and training and that type of thing. So if we can have
Absolutely. All right. So the first thing to know, I think, is that breastfeeding a baby with a full milk supply, so from, you know, for the first 2 or 3 days post-birth, you don't have a full milk supply yet. And then somewhere between day 4 and day 7, your milk will come in and you'll have a full supply. A full supply of breast milk takes somewhere between 400 and 600 calories a day. And I would say for most women closer to that 600 mark. We're in a position where you've gone from needing roughly 300 additional calories a day in your 3rd trimester to needing double that after your baby's born. So I think that's something that people don't expect. They think they're done growing their baby, and that their pressures on your body should ease off a bit. And the reality is the calorie requirements are more. And your body, even if you ate garbage, even if you ate McDonald's for breakfast, lunch, and dinner, your breast milk will still be top shelf, right? It will still be the best possible quality, because it will take what it needs from your muscles, from your bones, from your blood. That your body will produce fantastic breast milk, but you will deplete yourself of everything that you need.
Wow, that's so interesting. I never knew that. So it's kind of like it's the same as during pregnancy, where your body, the baby will take pretty much whatever it needs, and it'll draw down from your vitamin stores, your calcium stores in your bones, from your muscle, all that type of thing. So it's exactly the same
the same thing with breastfeeding. And so people ask me often, is there a specific diet I need to have, or is there foods I should avoid or anything when I'm breastfeeding? And my answer is always, it depends on how healthy you want to be. So it will only affect mum's health. It won't really affect baby's health, not really. You need to focus on your nutrition to make sure that you stay well and can look after yourself and your baby and your family.
So you're definitely not advocating for eating McDonald's lunch and dinner. Like,
in the holidays postpartum, you eat whatever you want to bring you joy. You've just run a marathon. If what you really, really want is McDonald's, eat McDonald's. But probably don't do it continuously for the next 6 months. You probably won't feel very well. But I would say this is a period of time where you can focus on the things that you've missed during pregnancy. You can have sushi and soft cheese and whatever else it is that you've been missing that you haven't been able to have. There is nothing you can't.
Yeah.
Yeah, all the ridiculous things that you never thought that you couldn't have until your OB tells you. Yes, eat all the things and have a coffee. That's fine. Have a glass of wine. That's fine. There's very little there is some anecdotal evidence that babies might be more irritable if you're drinking too much coffee, but one glass isn't going to do it. And if you're going to have a glass of wine, the best possible time to do it is when you're actually feeding your baby. You might get funny looks, but it's going to give you the longest amount of time between when you feed and when the alcohol that you're drinking goes into your breast milk. So sitting down to do your 7 o'clock feed and having a glass of wine and talking to your partner while feeding your baby is the most restorative thing I can think of.
You heard that here first, people.
There are, alcohol is an absolute no-no in pregnancy, but in breastfeeding, it's a much more, it's a much bigger gray area, and you'll find the level you're comfortable with. There are apps called the Feed Safe apps, where you can put your alcohol in and it'll give you a countdown timer until you can feed. But the reality is, if you would feel comfortable driving your car, so if you're underneath the legal limit to drive your car, you're fine to breastfeed. That's more or less what we say.
Okay. And what about training? So let's talk a little bit about like breastfeeding and training and that type of thing.
So the thing about there is some evidence to suggest that losing large amounts of weight while we're breastfeeding isn't the best idea. Small amounts is fine, but embarking on a goal to lose 100 kilos while you're breastfeeding is probably not the best idea. Now, the reason for that is that we have chemicals that are stored in our fat cells, and when they're metabolized, there's some evidence to suggest that that gets then metabolized into breast milk and baby can ingest it. Now, that is, really, the studies on that are fairly new. They're fairly minimal. They're not hugely reliable. So training to get back to what you were pre-pregnancy is perfectly fine for breastfeeding. I would say that you need to be conscious of, you don't need to be conscious of much other than hydration. So remembering that you're producing somewhere around 1 litre of breast milk a day. So
that's amazing.
So the average baby takes between 750 and 850 mils of breast milk a day in, and then you've got leakage and other bits that sort of get us closer to the litre. So making sure that you look at what your normal requirements are in training, and then adding 1 litre on top of that to your intake. The biggest thing with training is sometimes it can increase the saltiness of your breast milk, and that's purely a taste thing for baby. So sometimes babies won't, when you have that lactic acid buildup that you were just mentioning before, some babies won't want to feed immediately after you've trained until you've calmed down.
Until you've showered, maybe?
Some of it is about actual sweat on your breast. Yes, it is. And some of it is around the chemicals that are pumping through your body immediately post-workout. But I would say most babies are completely unfazed by it, and you won't know until you're feeding your baby and you know. And if you find that your baby is fussier on the breast immediately after a feed, try wiping off your breast first with a wet wipe, and seeing if it's just the sweat on your breast taste. And then if it's still a problem, it might be that we just need to wait 20 or 30 minutes after a feed for baby to be comfortable at the breast.
Okay, that's very good advice. Yeah. So, like if you want to breastfeed after training, maybe just make sure that you have a shower and give it half an hour, 20 minutes to half an hour.
But only if you're finding they're fussy. Chances are your baby won't care.
Yeah.
Because there are huge taste differences in breast milk. So your breast milk is constantly changing taste depending on what you're eating,
Mm,
what time of the month it is once you get your cycle back.
mm.
So estrogen fluctuations in the body affect breast milk taste. If you're fighting off an infection or a virus, your body will produce antibodies that affects the taste of your milk and the color of your milk. So when pumping breast milk, the color can be anything from pink to white to blue to yellow to green to orange, and it's all sort of within the range of normal. And yeah, so
That's amazing.
yeah,
I tried this, or I'm learning so much from all those. Like, I don't know hardly any of this stuff because I guess it's kind of out of it's a lot more out of my usual realm. So this has been super educational for me as well. I'm like, I didn't realize that you can have breast milk all of those colors. That's
it
crazy.
is. It is. Look, it is a. As I said, people don't grow up in life just planning to be a lactation consultant. This is an area you'll find people are drawn to for a variety of reasons, but it's certainly a pretty unique knowledge set,
Mm.
and it makes me useless when it comes to a trivia team. I don't have a particularly useful skill knowledge base that will help if you're playing trivia, but in helping women breastfeed their babies, I think it's pretty useful.
So I mean, I think as you know, I don't have children, but I'm coming from a place where all of this is quite new to me. So if I was to kind of go down that path, there
Mm.
would be a lot that I would need to learn, I would say. So if for those who are having their first child, like what kind of things can you expect, or like what would you expect when you are having your first child in this kind of journey?
I think um, the normal experience, if we talk to what the average experience of a patient that I see in rooms is, they focus heavily on their birth, particularly around where we live, Tammy, that we have a fairly well-educated, affluent, interested, engaged group of mums coming to motherhood for the first time at a point of their careers where they often are quite in control of their world, right?
Mm-hmm.
Um, the biggest thing that happens, the thing that happens is people have this real shock when they get their baby of how little control they have over their experience. So it starts from often having little control over their experience of early of their birth, and then having little control over their experience in the hospital after their baby's born. That things are happening to you, and it's difficult to advocate for yourself. So some of that is unavoidable, and some of that can be plans for with building your knowledge base before you go into birth. So educating yourself on what breastfeeding looks like, making a plan for what postpartum looks like. So we talk about making birth plans, but I think what's actually more important is making a plan for what that fourth trimester looks like for you. What are your goals for your fourth trimester? Are they to have a active postpartum period where you're training? Are they to have additional support? Have you got someone that can come and help you so that you can just sit and feed the baby? Because the reality is, if you're sitting on the couch feeding your baby for 8 to 10 hours a day, there's not a lot of time left to do anything else.
No.
So literally there is not any time. And God forbid you have other children running around that you also have to care for. So making a plan for what that postpartum period looks like, educating yourself, and then advocating for yourself. And if you can't advocate for yourself, finding someone that will advocate for you. So whether that be an LC in the lactation space, whether that be a postpartum doula to advocate for your care and nourishment post-birth. There are all sorts of people that work in this space that can advocate for you and be your partners in that journey.
Amazing. And before we wrap up, So, because this has been like such an eye-opener. I feel like I'm learning so much here, and I could probably talk to you for ages, but like we've
We need
got
to get on with our days.
So you have 4 children.
I do.
How would you feel about talking about, what you would feel would be the most difficult part of your pregnancy or postnatal journey? Because I'm sure that's probably influenced the
Yeah,
choice
absolutely.
of, careers, paths that you've gone down.
I think people hear that I have 4 children and relatively close in age at a relatively young age.
So how old are they? What's the age difference?
So I have my eldest just turned 9 last week, and then I have a 7-year-old, a 6-year-old, and a 4-year-old who's about to turn 5. So I had 4 in 4.5 years, and I had my first when I was a day or two shy of 29, so relatively young by Sydney standards. But they were all IVF babies. So I went through a very difficult process to have my children. They are very much planned and very much wanted. I was just lucky enough to meet my husband at 21 and have good medical doctors that were able to tell me that I wasn't probably going to be able to have them without help. So that was I had a very medicalized experience of early motherhood from the start. And I've been pregnant 6 times, but had 4 live births. So my body took a hit from all of that, from all of the drugs and all of the IVF and all the rest of it. And then having my eldest, he had a series of medical complications of really long words that I won't bore you with, but basically was allergic to a lot of things, had multiple hospitalizations, and largely couldn't breastfeed. I pumped exclusively for him for a year, and he was sometimes fed via a tube and sometimes fed via a bottle. And we had, as I said, I think earlier, we had lots of lovely help along that way, and we had some less helpful medical staff along the way, and some that built me up to be the mother that I am, and some that stood in the way of me becoming the mother that I think that I am. And I think they are all now extremely healthy, happy little human. In fact, my eldest is not that little anymore. I think he's almost in the same shoe size as me at 9. And as an almost 6-foot woman myself, I do not have small feet, so it's very confronting to have him grow up so quick. But I want to be one of the people that builds other mums up and helps them become the mum that they want to be. And my experience, largely with my eldest Graham, going through that gauntlet of medical and allied health to come out the other end, made me passionate about being one of those people that doesn't stand in mum's way, that helps them and builds them up. And I think, Tammy, that's what drew me to work with you, is that you're someone that builds people up and helps them be who they want to be and not imposing what you think they should be onto them. So I'm sure that whoever else you have that you're doing interviews with will be similarly passionate in that way.
I think any woman, and thank you so much for sharing that, because it is like your story is actually so beautiful, and you can hear how passionate you are in your voice, and when you talk about that journey, you can really see why you've chosen the path that you have. And the women that work with you, I know that you will be supporting them in the most amazing way that you possibly can, and they're really lucky to have you. But I also think that women who do this type of work, you can't do this type of supporting work if you don't have that passion behind you, that want to actually care for other people and other women and see them do well and support them, as best as you can. You're not always going to get that right. Sometimes you're going to get it wrong, and maybe your way of doing things doesn't match with what they need. And that's something that you kind of learn along the way, and you understand.
I'm not always going to be the right LC for everybody. Either my style, my way of doing things, my way of explaining things isn't going to work for everyone. And if someone comes to me and I'm not the right person, I will always recommend somebody else, because I'd prefer they get the help from someone than get it from me. There is
obviously you'd prefer to get them from you, but if they're not the right fit,
no, but I can't be the right fit for everyone, and pretending that I can is not going to be very helpful.
No, that's very true. And just before we wrap up, what's the one thing that you wish that women knew before they had a baby? Because if there's one phrase that I wish that I could kind of erase from so many women's pregnancy and postnatal journeys or their maternal metamorphosis, would be the phrase, I wish I knew that before. Because I get so many women that come to me and, they say, I wish I knew that before. So what would be the one thing that you wish women knew before they had a baby?
It takes time to learn to breastfeed. And I think this comes back to exactly what we were talking about right at the beginning. It takes time to learn, and you're not expected to learn on your own. You're not on your own in learning to breastfeed. There are people out there that will help you. I will help you. The Australian Breastfeeding Association runs a helpline that is 24 hours a day, 7 days a week. There is always someone on the end of that phone that will help you. And if you can learn before the baby comes, great. But even if you do, you will need help when your baby gets here, and there are people to help you. Lean on them and try not to be super mum. We wouldn't expect to learn to ride a bike on our own or learn to swim on our own without help. You can't expect to learn to breastfeed on your own without help. Reach out, get the help that you need.
I feel like having a baby kind of is almost like being thrown in the deep end and being like,
Yep.
okay, swim.
Yeah, and you just want someone to throw you a life raft, honestly.
Yeah.
And find your village, find the people that will help support you, and that hopefully may include a lactation consultant if breastfeeding is part of your plan. But build your support network of people that will build you up into the mum that you want to be.
Amazing. Ellen, thank you so much for your time.
You're welcome.
It's been such a phenomenal conversation. And I've personally learned so much from this. And already when you were talking, there were so many bits. I'm like, oh my God, that's amazing. I was already my brain was already kind of thinking, oh, that's such a great point. And so thank you so much for your time today. I really appreciate it. And what we're going to do is we will pop down all of Ellen's details. So if you want to reach out to her, I'll pop her social media in the bottom of this, and feel free to reach out if you need a hand, if you're pregnant and you would like some help with your pregnancy breastfeeding journey, because you can start this earlier by the sounds of it. That's something that I didn't know. So that's great. So if you're currently pregnant, you can actually start working on your breastfeeding journey in pregnancy, and obviously during your postnatal journey. I think every single woman needs the help of someone like you. So you're a very valuable asset to all women. So thank you so much for your time today. And if you're hearing this message, I want to say a huge thank you, because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode, or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can actually apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.